The U.S. government, through Usaid mission in Uganda, have handed over a total of 48 digital chest X-rays, 2 thermal scanners and a consignment of personal protective equipment to the Ministry of Health. The equipment is to be handed over to 48 districts of Uganda in tuberculosis screening and other related body scans and diagnosis. The Minister of Health, Dr. Usaid, says the donation is a great milestone in wiping out of TB by 2030, as this is to enhance surveillance, screening and treatment.
Uganda is on the World Health Organization's list of 30 high TB burden countries, with an estimated 94,000 people falling ill each year with tuberculosis. According to Assistant Commissioner, National TB and Leprosy Program, Dr. Stevia Toriahabwe, the country has made progress in TB detection over the past decade, but significant challenges remain in its efforts to end TB by 2030.
We see a lot of TB alongside lake shores in the fishing communities. This we think could be related to the high prevalence of HIV in these populations. You know, TB and HIV somehow move together. So part of these X-ray machines we have received is to help us in the people living with HIV. How can we make sure that we detect their TB early? So we want a person living with HIV to have an X-ray at least once every year.
Receiving the portable digital X-ray equipment at Ministry of Health headquarters, the Minister of Health, Dr. Usaid, expressed gratitude to the American people for the donation, saying this is a great stride in eradicating the disease.
This is to enhance our efforts to end TB by 2030. But the digital X-ray machines will not only support our efforts in TB, but also in many other respiratory diseases and any other conditions where we require X-ray services.
Acheng is optimistic that this donation is to boost the ongoing healthcare integration programs.
When you go to a facility, you should be screened for everything, depending on your history and your signs and symptoms. So we are encouraging our health workers. For example, if somebody goes in with a cough more than 2 weeks, do not only focus on TB, focus on all the other causes of cough and look at a person holistically.
While handing over the equipment, the U.S. Ambassador in Uganda, His Excellency William Pope, says U.S. government will continue to support emergency healthcare services even when Usaid mission exits Uganda.
We estimate, we hope that over 500,000 people can be screened just in the coming year with these donated equipment kits. It's an example of the work that we're continuing to do in the health space and the public health effort with the Ministry of Uganda and with local partners. Of course, the United States has been doing an overview and review of all of our foreign assistance worldwide.
If just 48 of these machines are used consistently over 1 year, with 80% deployed in active case finding and 20% in passive case finding, Uganda will have the capacity to screen more than 500,000 people.
Through the current investment in digital X-ray platforms, the country has reached over 120,000 people, and out of which 4,000 people have been diagnosed with TB and have actually been started on treatment. The addition of 48 portable digital X-ray equipment will greatly enhance the diagnostic capacity and ensure proper management of TB and other lung diseases. Furthermore, the provision of the 33 TB lab platforms will ensure same-day testing. One of the other aspects is that sometimes maybe you'd find because of distance results delayed to get to the communities, but with this 33 TB lamp, once you provide the sputum, then the results would be provided on the same day when you provide the specimen.
Since 2000, under the U.S. President's emergency plan for AIDS relief, PEPFAR, the United States government has contributed to saving an estimated 74 million lives globally.
Because we have done amazing work together with the government of Uganda, with the Ministry of Health more specifically, to build a strong foundation. I think if you look at the number of people who are trained, the fact that we are moving to utilizing technology to help us detect diseases early so that we can respond early, so we can prevent, is a testament to the sustained leadership commitment from health workers all around Uganda implementing.
An example of the work that we're continuing to do in the health space and the public health effort with the Ministry of Uganda and with local partners. Of course, the United States has been doing an overview and review of all of our foreign assistance worldwide.
The joint endeavors have prioritized reaching underserved and vulnerable populations who face the highest burden of disease and the greatest barriers to care.
We need to understand why is this our community getting more of this disease. There are certain things that can be done at community level. I've talked about the ventilation and housing, nutrition, the use of tobacco. You can change. So those things can be modified, and once we are at the health system, we are able to detect and also provide preventive treatment to those that have been in contact, and the population is doing the prevention at that level, including taking the children for immunization at birth. It should be able to help us to reach the target by 2030. So we all need to come up and uptake the services, but also do something to prevent ourselves from contracting the disease as individuals.
I'm Nafka Farida and Setumba Douglas.